Welcome to OOD Works, the podcast, a show about unique individuals and services provided by Opportunities for Ohioans with Disabilities, the state agency that helps individuals with disabilities find a job and be more independent. Here's your host, Kim Jump.
We have a special treat in store for you. Mykenna Roy is a first-year undergraduate student at The Ohio State University and pursuing a Bachelor of Arts in Public Management, Leadership, and Policy, as well as a Bachelor of Science in Biology. She is on a pre-med track, and she really strikes me as someone who epitomizes be the change you want to see in the world. And she'll share with us some of her experience in healthcare as someone who is deaf in both ears and wears bilateral hearing aids. Not only is she active on campus, but she helped found a startup company called Aleph Innovations, working to implement artificial intelligence technologies in the healthcare sector. She was a 2022 participant of our Youth Leadership Forum in Cleveland, which is a collaboration of Opportunities for Ohioans with Disabilities, the Ohio Statewide Independent Living Council, and LEAP, which stands for Linking Employment, Abilities, and Potential. Welcome to the podcast, Mykenna.
Hi, it's so nice to be here.
It's great to have you. I've been looking forward to our discussion today. Your semester at OSU just wrapped up just days ago, right?
Yeah, I got back a week ago.
Just a week ago. So tell us what you've been studying and focusing on and kind of how that first year went for you.
Yeah, so college is going really well. My first year was pretty awesome. I have a GPA of 3.5, not too bad.
Nice.
And I absolutely love it at Ohio State. And like you said, I'm currently pursuing a dual degree on a pre-med track. Going into my second year next year, I'm getting my Bachelor of Arts in Public Management, Leadership, and Policy. And then I'm pursuing a Bachelor of Science in Biology. And I'm also taking classes this summer because I absolutely love learning new things and continue my education as much as possible.
Oh, wow. Okay, so are you currently on break before summer term kicks off? Like, how much of a break will you get?
Today was the first day of summer term, and yeah, so I got about a 6-day break, and now I'm doing online classes.
Oh my goodness, your energy level. I mean, not only are you doing this very aggressive, dual major and track, but the fact that you're rolling right through summer. Kudos to you. That's a lot.
Thank you. I'm really excited about it, though.
That's absolutely terrific. Tell us how you're involved in campus.
Yeah, so I kind of hit the ground running. I joined student government, the undergraduate student government at Ohio State as part of the academic affairs committee. That was really fun. What we did this past year was we got a campus-wide New York Times subscription for everyone. So that was one of the things we advocated for. And we also gave out academic enrichment grants to students who might not have the educational opportunity to pursue some of their bigger goals. And then recently, I was just elected as an on-campus senator for the 56th General Assembly of the undergraduate student government. And we do a lot of advocacy work. And as a senator, I'll be voting on issues that matter most to the students. So it's really fun to have that kind of connection with students. And then aside from USG, I was also a part of my Residence Hall Association. I was a representative for my building, and I was the vice president of my hall council. And we did a lot of engagement events that brought students together, and it was really rewarding to see how I could help promote community and bring students together over fun events. My favorite event was a trip to see Hamilton downtown in Columbus, and it was totally free for students because we have a budget in the Residence Halls Council, and we use that to pay for events that students otherwise wouldn't have the chance to do.
So impactful. New York Times subscription, what really helped create the idea that could be beneficial to students?
Yeah, so that wasn't initially my idea. It was I was in a group of people in the academic affairs department, and somebody else had that idea. They were like, hey, New York Times is a really good educational resource, and they provide a lot of current events with factual-based information, and we thought it would be really important for students to have access to a resource like that. And Ohio State had a very large budget with a lot of money, and we were like, what if we allocate some of those funds to a subscription that would be discounted for students, but also benefit them in a way that could enrich their education?
Yeah. I'm totally surprised to hear it. I love it. And then just your leadership. Have you always been this way where you're willing to just step up as a leader?
Yeah, actually, high school, middle school, elementary school, I started with student council. I was kind of put in as like a representative for like my third grade class, and then ever since then it's just grown. Like high school, I was class president. I was president of the National Honor Society. I was captain of the cross country team. And I held a bunch of different leadership positions in different clubs. And I think I've always thrown myself into that position because I'm tired of waiting for other people to try and make the change that I want to see. So therefore, I try to put myself in those positions and I try to make those changes, because if someone else isn't going to do it, then I'm going to do it. And I think that I really enjoy being a leader because it allows me to connect with other people and with the people that I represent, because as a leader, you represent a community of people. And it's really nice to hear from people what their main concerns are and hear from their different perspectives, because I'm only one person and I only know my own life stories. But if I can listen to a bunch of other people's life stories and the things that they like to do and things that are important to them, it's really beneficial for me to take those stories and kind of implement that into the decisions I make. So I really enjoy that part of it.
Outstanding. This is so inclusive what you're doing. And to think you've been at it since third grade. And I should mention you're originally from Highland Heights, right?
Yeah, I'm back home in Highland Heights, Ohio. Yes, I went to Mayfield City Schools, and they have a program for deaf students. It was the Millridge Center for the Hearing Impaired. That's how I started, and then just went up from there.
Excellent. So you're passionate about the healthcare system in particular. Can you tell us a little bit about how that all began?
So I always needed hearing aids my entire life, and they cost a lot of money. And I've always seen my mom kind of be like, oh my gosh, I don't know how we're going to pay for these. And luckily there were state grants and funding opportunities that we could get that allowed us to have these hearing aids. But then I kind of realized not everyone has these opportunities. That you have to be below a certain income level, you have to have this age, you have to have all of these requirements. And it's just for a device that I couldn't live without. Like I could not live without my hearing aids. They have gotten me to where I am today, and they are the reason that I'm so involved in everything I can do. Like it is a device that I consider a necessity, but insurance companies don't consider them a necessity. And that's something that's always bothered me. One of my goals is to go up in the ranks in the healthcare and work in healthcare management, because if I can advocate for hearing aids and other assistive devices that are not considered a necessity, but people actually need them to, do their daily tasks, and they need this for just their daily lives, I think that would be really awesome, because then who are insurance companies to say that somebody needs or doesn't need something? I think that as a healthcare professional and somebody who experiences things firsthand, you should be able to make those decisions. And I'm not really a fan of how there's kind of like power role with like insurance companies and then the healthcare system. And so I feel like if I put myself in the healthcare system, but also kind of in a decision-making perspective, it could help like bridge the gap between insurance companies and people with disabilities and anything that anyone else might need, because there are so many things that are not considered a necessity, but other people would. And it's just, I've always kind of hated that. And I think that's kind of driven my passion. But I also like the human body is fascinating. I've always loved learning about it. And I knew that like becoming a doctor is going to be the thing for me.
And that is your ultimate goal.
Yes.
Yeah, that's awesome. So it sounds like you're already clear too that you want to get into healthcare, and then you want to continue to advance to make more of an impact even.
Yeah, so that's why I'm doing a dual degree thing. I'm doing biology so I can, learn about the things I need to learn about, but I'm also doing public affairs so that I can kind of learn how to interact with people and become a good public representative, so that I can work within the public sector and figure out how to best implement new policies and change some existing policies. And my goal for med school, Ohio State and a bunch of other colleges offer a combined MD MBA program. And I was thinking it would be pretty cool to do that and, get like the medical perspective, but also work in like the business aspect of it. So
Yeah. You have such a roadmap of where you want to head already. It's fabulous.
Thank you. I've always known I wanted to create change, and I didn't know how to do it until this past year. I actually started Ohio State as an undecided major. We have like a million majors, and I was like, which ones do I choose? And then I ended up picking those two, and then it kind of was clear to me how to get to where I want to be. So,
tell us about your startup that you're involved in. What really the goal there is, because I know it's right in line with your passion that you're sharing.
Yeah. So my startup, so at Ohio State, I'm part of the STEM Scholars Program, and that involves like a learning live-in community of people who are in STEM major, then focused on like STEM topics. And I met these 500 people, and they founded the startup called Aleph Innovations, and then I kind of joined in like a week after they created it. What we're trying to do is create artificial intelligence technology. So we have computer science people and data scientists and engineers that can like code the program for that. And the goal is to implement that into the healthcare system, because one of the biggest problems within the healthcare system is, have you ever used like MyChart or Epic?
Oh, yes.
Yeah. So let's schedule appointments. It's a pain. Doctors and patients, everyone hates it. It's awful. It's so inefficient, and it takes such a long time for patients to be able to communicate with doctors, ask for prescription refills, and just be able to get to the specialist they need. And when we looked at the data from that, it takes up to like 7.6, on average, 7.6 years for patients to get diagnosed with rare diseases and 50 days for like a common illness. And that's such a long time. So what we're trying to do is create an AI system that just eliminates that time. So the computer's going to take in data from what the patients, like what they're experiencing, like their symptoms and what they're going to the hospital for. And then it kind of takes the data from the providers and what they're specialized in. So if a provider is really good at diagnosing this thing, or if they're really good at treating people with these conditions, the computer matches those patients to those providers. And it says, hey, you might want to check out a list of 4 doctors instead of a list of 500. And it kind of streamlines the process, and it more evenly distributes patients to medical professionals. So not only will patients be able to see doctors sooner, but the doctors will get more patients, and insurance companies won't have to spend as much money on patients being able to, or having to see a bunch of different specialists at once. So it's just better for everyone.
Yeah.
And if we can continue to develop this technology, eventually we're going to kind of try and expand it like years down the road into renewable energy and possibly start in that sector. But for now, healthcare is where we're at. And that's going to be like my own little project with the group, because right now we're a startup. We're still in the startup phase, but we have contracts with university hospitals, and we're currently communicating with the Cleveland Clinic about working with them and coding the system. And it's really awesome, because even though I don't know much about computer science, I'm the person in there that communicates with the doctors and patients and kind of involves the tech people in a humanistic perspective. And it really allows them to take the computer and the AI system and make it work for people and not just for numbers and money and stuff, because we really want to help people, and that's our goal.
Wow, what a wonderful use of artificial intelligence to try to expedite the process. I mean, what you're describing really sounds like a win for everybody, a win for the individual who needs medical help, a win for the insurance, as you said, because it's more efficient, and a win for doctors being able to see really the right patients.
Yeah, so it benefits everyone.
Wow.
And it's just a computer that's really taking data, and it does the work, because humans, like, we're capable of thinking of things, but sometimes we don't see things all at once because our brains just aren't that fast. The computer can do it instantly. And if we can use that kind of technology to our advantage, then we can really use it to benefit the public good. So
yeah. Wow. So how do you find time to work on that?
Okay, so we have it's a lot. It really is a lot. Right now, what we're currently trying to do is add on interns, and I'm technically like HR. That's my position. So I have been communicating with potential interns for the summer because there's a lot of coding to do, and we only have 2 people that are really good at coding and they're able to do that. So we're trying to get interns to come on in so that everyone can work on the code and figure out how to best do that. And it does take a lot of time, but I kind of like set aside different times in my week, and we have like 2 meetings like on the phone, 2 1-hour meetings per week about like what we're doing and what our goals are and tasks and stuff. And we kind of just text each other in our group chat, and we're like, okay, this person does this person does that, try to get this done within this amount of time. And since we're all friends, it's really easy to be flexible with each other, but also be like, hey, like, can you do this in this amount of time? And then we say yes or no, or let's try this. And it's so nice to work with each other in that aspect. And then obviously, like, classes, we're all students at Ohio State, we're all freshmen about to be sophomores. So we all have our classes like during the day, and then kind of at night we work on extracurriculars in the company and stuff. And I will say I'm not a coder, so it doesn't take me as much time as some of the other guys. So I'm able to do my extracurriculars a little more than they do, but they're really passionate about that, and I'm super passionate about like my extracurriculars, but also the communication aspect of the company. So it works out. Yeah.
Yeah, sounds like it does. And I'm just really impressed how you've taken your own frustration as being, a consumer of healthcare, a patient, and you're flipping it. You're using it to try to make it better. That's what it's all about right there. That's like the ultimate responsibility.
Yeah, thank you.
Wow. Blown away. How did you get involved with opportunities for Ohioans with disabilities?
So my mom's a sign language interpreter for the Cleveland Metropolitan School District, and she was telling me one day how her students really benefited from OOD and the services they provide. So we reached out to see how they could help me in terms of my long-term career goals, and it just kind of went from there. And then at one of my first OOD meetings, I found out about YLF, and then it just like all the opportunities it was like a door that opened, and it was really so. My mom was the one who introduced me to that.
You did YLF Youth Leadership Forum last summer, right?
Yes.
A look back 1 year later, what has stuck with you about that experience?
So one of the things that they really pressed in YLF was getting involved with your community and advocating for the things that you want to see change. And like we wrote letters to our representatives and people that could make change. And that's something that kind of stuck with me because I feel like sometimes there's a lot of underrepresentation in like public affairs and politics for people with disabilities. And it's really important for us to make our voices heard because if we're not the ones that are going to do it, no one else is. So YLF really encouraged us to stand up for what we believe is right. And I think that was something awesome and something really important to see because it is true. Like we are the only people that are going to be able to make the change for ourselves. And if we can gather together as a large enough group, then we can really make that change possible.
Yeah. Have they invited you back to speak?
Yeah, so they invited me back to help with this year's delegates, either as like a little bit of a mentor or speak a little bit. And I haven't decided what I'm going to do within that regard, but I'm going to talk to Cheryl about how to, work with that, and we'll figure it out. But yeah, I'm excited to help out with this year's delegation.
You'll be a wonderful role model to this year's participants. That's great.
Thank you.
You had shared that you've had a lot of people in your court supporting you along the way, that they've been very important in your journey. And I wondered if you could just speak to that.
Yeah, I've had so many different people help me along the way, and I'm so grateful because none of them are like each other. Like I've had my family. My family's always been supportive. They're like, yes, go achieve those dreams, and we'll be here to catch you if you don't quite get there, and that's okay. And that's like a nice support system to have at home. But also within school, I've always had teachers and classmates that have been like kind of like, here's this opportunity. I think you'd be great at this. Try it, go for it, do it. And they just let me know about the things that I'm capable of because I think I've kind of known that I'm capable of a lot of things, but they just let me know like you can actually do something with this. And it's really encouraging to know that there's people around me in my position and that are like mentors, and they're able to help me get to where I want to go. So it's throughout my entire like primary education, it's just been wonderful to have people like in my corner and just give me the opportunities that I know I could benefit from. And then it's really nice to kind of network with those people too, because it's like, hey, you're studying this in college, and I know you might like to do this, and it's like great. So, but then also as I've done like programs and stuff and volunteer opportunities, like I volunteered with Youth Challenge, and then I was connected with the CEO for that, and he was really awesome, and he showed me a couple of different opportunities. Like I got to speak at the March for Access this past September. It was the March for Access in Cleveland, and it was really nice to be able to speak there and kind of just share a lot of the things we're talking about. And that was like, he's always been a strong encouragement for me to just go and do these awesome things. And like YLF was one of the programs I did that introduced me to people that kind of showed me like, you can do these things, here's how you do it. And it's really nice to just have all of these different people in my life, whether I know them for a day, a week, or like years. It's so nice to kind of connect with that, because I think that that's kind of awesome about the human experience, because as you get to know people and you connect with them, they can give you things like conversation and learning experiences that you can take with you forever. And I think that's something I'm really grateful for with the people I've had that have helped me get to where I am now.
Mm-hmm. Well, and I love that your outlook is that you can learn and you can glean something from everybody that you're interacting with too. I think that probably sets you apart in your, your student activism, that mindset. What's next for you besides getting through this summer?
So getting through the summer, that will be that. I'm going to complete, I think, 3 more years at Ohio State, because that's how long it will take me to complete my 2 degrees. I'll do the MCAT at some point, apply to med school, hopefully get in, pursue an MD, MBA, and just go from there. But I think my next 3 years at Ohio State, I'm going to try and be pretty involved with student government. And then there's a pre-med fraternity I was thinking of joining. It's Phi Delta Epsilon, and they're like nationwide. It connects you with a lot of medical specialists, and I feel like that would be a pretty beneficial org to join. But I don't know, I might not have the time for that, so we'll see. Yeah, I think just advancing in my position in student government, but also like where I am on campus, and then our company, we're going to be taking off pretty soon and hiring employees, so that'll be pretty fun.
Just amazing, you're balancing all that. Do you plan on doing medical school in-state, out-of-state, keeping your options open, or?
I'm keeping my options open to anywhere, wherever life takes me. Ohio State initially was a safety school for me. I applied to a bunch of Ivies and stuff, but then I realized Ohio State was the cheapest option, so it was pretty good. And then I also like how public schools are they're very like, they get federal funding, so they're very accommodating for people with disabilities and all of that. So I think that's awesome. So I think I would try to go to a public school, not necessarily like in or out of state, but there's that. But I'm also like, I'm 15 minutes away from Case Western, and I think that would be a pretty cool school to go to. But we'll see. There's tons of options, and I'm just keeping my options open. So
yeah, that's great. So at YLF and even at Ohio State, what's it been like to connect with other students who have disabilities?
So at Ohio State, it's been pretty tough because not many disabilities are visible, and there's a very small deaf population at Ohio State, so it's kind of hard to find the people that are the same as me. But we do have students with disabilities at OSU, and it's like when they kind of make themselves visible, it's really easy to connect and be like, hey, what's it like being a college student with a disability? And those conversations are really nice, and they're important to have. And I really enjoy that part of it, because I do feel like having a disability is one of those underrepresented populations, because we, as a society, we give a lot of attention to different races and ethnicities and cultures, and those are amazing, those are great. But sometimes I feel like disabilities are a little bit underrepresented. And I think it's up to us to kind of bring that up and make it a little bit more seen in the media. And so YLF, the thing that attracted me to that was that there was a leadership forum specifically made for kids with disabilities. And I was so excited to meet other like-minded individuals who are also kind of going through the same thing that I was, because throughout my entire life, like been putting I've been putting myself in leadership positions, and a lot of people kind of respond with, oh my gosh, you're deaf and you're doing that? Like, that's so cool. And while they kind of mean it as a compliment, it's also kind of like me being deaf doesn't exactly stop me from doing that. It's just that like society kind of tells students with disabilities that they can't really do everything that someone without a disability could do. And so that's always been a little bit of a frustration of mine. And I just thought that YLF was really cool how they were kind of giving students with disabilities a platform to really make the changes that they wanted to see. So it's definitely important to have those conversations with other students with disabilities, but also connect them with people without disabilities, because communication is the only way we can really overcome those barriers that we've set in our society.
Are you fluent in sign language?
I'm not fluent, but my mom is and my dad is, and I know enough to be able to converse with them. I wish I could learn a little bit more, but I've grown up in a hearing world, and I've kind of been forced to acclimate in the way that I have. So I don't know as much as another deaf person might, but I do know enough to have a basic conversation. So.
What would you say is most important to you that you've learned about being a leader?
I think one of the important things about being a leader, and it's something that's always stuck with me in all of my leadership positions, and it's something that I continue to learn every single day, is that when you're a leader, you aren't the boss. You're not the top man. You're not like the president in charge of people. You're representing those people. You are their voice. You are the one that takes what they need, tries to find out a good solution, and then figures out the way to implement that. So whether it's like student government or in a club or in a political position of power, you're not in charge of people telling them what to do. You're kind of saying, hey, we're a team. This is how we're going to make this as best as we can. But these are the people that we're trying to serve and represent. I think being a leader is not about yourself. And it's not, I think it's one of the more selfless things that you can do, because a good leader is someone who puts others before themselves. And that's something I've always done. And it's something that I continue to learn how to do and learn how to implement, because other people are the people that you should be serving. And as a leader, it's your job to make sure that that gets done, because you have a higher position yourself, and it's important to not take advantage of what you could do with that, but to use it for good and to make sure that you're helping people in the way that you're able to. So I feel like sometimes people see others with disabilities and they look at them as like, oh, this is what they can't do. Like, it's not typical to see someone with a disability in a leadership position. And it's not because we don't want to be in those positions. It's because other people tell us that we can't. So I think it's important for anyone with a disability, or just anyone in general, to kind of take that and just be like, just because you say I can't doesn't mean I can't. And it's easy to kind of let those voices get to you and have people tell you, so many people telling you can't do this. It's easy to believe that yourself, but it's important to kind of keep a strong mind and, you know, put on like the blinders and be like, just because other people say I can't doesn't mean that I actually can. And if you believe in yourself, there's nothing stopping you. There's only one person that you're spending your entire life with, and that's yourself. And so it's important to give yourself the love and encouragement that you need to grow, and also remind yourself like, hey, these are things I could do. Like, you have your goals that you know you can reach, and then you have some goals that you're not sure if you can reach, but it's worth a try to try and get there.
Yeah, so. I like that. Well, if we happen to have any high school students, maybe nearing college, or students about to begin college, what would your advice to them be?
So I went into college kind of with a little bit of an idea of what I was going to do, but I had no idea how I was going to get there. I was undecided, and I went to a campus of 40-something thousand undergraduate students. I felt like one of a million. It was really hard to kind of find my place there, and
sure,
it was scary. I struggled quite a bit the first semester, and I just would tell students about to start college that it's okay. Be patient with yourself. Be patient with school. Take whatever opportunities you can. Some might not work out. I applied for a lot of things that I didn't get into, but I also applied to some things that I did get into, and things work out. And if you don't like it, it's okay to say no, and this isn't for me. But if you do like it, keep going with it and see how far you can go. because the possibilities are endless. And I know it sounds kind of cheesy, but it's true. There's so many things that you can do with yourself in your life, and college is just kind of the first step, because once you get that education and you have that degree, you can do so much with that. And it's okay if you don't exactly know what you want to do, because you have 4 years to figure that out, or 2 years if you're going to community college. Whatever it is, just be patient with yourself and take your time, experience it, love it, learn, grow. The process is part of it. So, yeah.
Well, this has just been amazing, Mykenna. Thank you so much for sharing your journey. And, I wish you all the best this summer and in the coming years.
Thank you so much. I truly appreciate you giving me a platform to speak. And I love sharing things and hearing from people and just like being able to give back. It's awesome. So thank you. I appreciate it.
A transcript of today's episode is available at ood.ohio.gov/podcast. We welcome you to subscribe and leave a review. We're on social media at Ohio OOD. Do you have a disability? Do you want a job? We can help. oodworks.com.